I was blowing the grass off the sidewalk, and just as soon as I got to close to the ramp, that's when it hit me. And after that, I don't remember nothing.
Got a call from family members letting us know that Mom was outside blowing the grass with a blower and screamed at the top of her lung that she was in pain.
And when they got to the hospital, they told me that can't do nothing right here. They had to bring this other hospital for brain surgery or something.
Not till we got to the ER, they told us that she had a massive aneurysm.
She had something called subarachnoid hemorrhage, which is when you have bleeding in a space around the brain called the subarachnoid space. It can either be caused by trauma. If it's not caused by trauma, which is the most common cause, the most common non-traumatic cause is an aneurysm rupturing. So that's what she had. She had a ruptured aneurysm.
So I went outside, I cried, got down on my knees in the middle of the sidewalk, and basically asked God to send me an angel. Went back in there. They did call us back to the hospital to go inside. They said that they did find a surgeon that was willing to take it on. He was at CHRISTUS Spohn Hospital.
My first interaction was when I got that day that they were prepping her for surgery. I walked in and I see him giving orders and his assistants giving orders, and I was just thinking like, okay, I felt at ease. I felt like we were gonna get somewhere. He seemed very confident in what he was doing. His staff seemed very confident. The nurses, they talked very highly of him. So I thought, okay, like, we're gonna see something. She got a shot.
Yes.
I saw her CT angiogram, saw the aneurysm, and my thought was that I could treat it with an endovascular approach. So the two main ways of treating an aneurysm are either with a coil embolization or with an open surgery. And I thought that she would be one for a coil embolization. So that's what I recommended to her family, and that's what we took her to do.
After surgery, they were able to take her off the ventilator. She was breathing on her own. Second day, they were actually able to pull out the tubes to where she could start to eat. She started talking, moving. You can tell there was some difference there, but you can tell that she was coming through.
It seemed like a very quick process from surgery and then to rehab. I felt like, was it what, a week?
Yes.
It was very fast. And I was scared. I'm like, already she's going to rehab? Like, is this normal?
Her procedure was a fairly straightforward coil embolization. So I use a catheter and I either go through the wrist or through one of the large arteries in the leg, and then put a series of smaller catheters up until I get into the actual dome of the aneurysm. And then I feed small platinum coils into the aneurysm until the aneurysm is blocked off, prevents it from rupturing again. A lot of times we don't see a dramatic improvement in patients right away, and she was no exception. You stabilize the aneurysm, but then a lot of it's in the patient's hands. So you've prevented that aneurysm from rupturing, and then it's just a lot of watching and hoping that, that they continue to improve. And she was one where it did take a little bit of time as we get older. Having an insult to the brain like a subarachnoid hemorrhage can really take its toll, and it took her some time to come around. Eventually she did.
He did good with me. And I'm very grateful he did this.
I mean, when you say that there's no miracles out there, well, when I look at my mom, she's a living, walking miracle. Not a lot of people can say that, but I can, and she's here for us.
I'm glad they bring her back and everything, and I'm glad the nurses that worked too hard for her, watching and everything. I mean, I'm real proud.
I will say it was the best decision we made. From Dr. Schmidt to the nurses to his assistants, they were the best. I will say he is a great asset to CHRISTUS Spohn. And my mother-in-law, every day she calls us, tells you, I love you, from me to my daughter. Pretty sure her other kids too. She gets to wake up and go to bed, call her kids, and I know she's very appreciative. So yes, I would say amazing care.